Well, the Gauteng government, we're told, is considering further COVID-19 restrictions. The province, currently the country's epicentre as far as the numbers are concerned. Premier David Makhura calling on residents to change their behaviour. But is that enough? Let's speak to health expert Dr. Kgosi Letlape. Always a pleasure having you with us, Dr. Letlape. Let's talk, if we could, about the situation and the potential restrictions just in Gauteng, provincial restrictions, a provincial lockdown, if you will. Will a tougher restriction make a difference, do you think?
Good morning to you and the viewers. Yes, I think the only thing that we can do right now is the non-pharmaceutical methods. The vaccines that have been done of the just over 2 million people will be protection at a personal level. It's not sufficient numbers to really make a big difference in terms of community spread. So the only thing that we could resort to are the non-pharmaceutical methods, which have worked for the first and the second wave. We need tougher restrictions, and people at a personal level should be behaving like we are on level 5. The numbers are too high. A 25% positivity rate is a very, very high positivity rate.
Doctor, where, as far as those restrictions are concerned, maybe add some meat to the bone for me if you could. Let's try and get a bit more specific. When we say tougher restrictions, are we talking about completely banning alcohol? Are we talking about closing schools completely? Are we talking about no church services? Just how drastic, don't hold back here, Doctor, just how drastic a call are you requesting?
Well, you know, we have a grandchild who's in grade 7, and the school voluntarily told kids to stay home, and it's home-based learning. So the challenge that we have in this country is about the disparities in our society, because the ones that can afford are now taking the right decisions at a local level, and we are now dependent on the authorities. You know, this notion of saying we have scientists that are advising this, we, as a healthcare professional, I think we need to see out the healthcare professionals that are providing certain positions, like saying, keep the schools open, as a, you know, totalitarian attitude, to come out there so that we can engage with them. And as you can see what private schools are doing, schools should make decisions at a local level. When you see that you have an unacceptable infection rate amongst your pupils and your teachers, management and staff, you need to close down to cap the numbers. This is only spread from person to person. So where we've got to be very, very tight is on gatherings. You know, whether it's at work, whether it's social gatherings, whether it's religious gatherings, whether it's on the basis of education, we now have to knuckle down. If you look at European countries, I mean, in Barcelona, they've only started evening activities yesterday. They've been closed down for 15 months. This is how we cap the infection. And we'd rather go tight for a short period than go this creepy crawly mechanism where the thing is getting out of hand. We should have been tougher more than a month ago. I'm going to use
that in future, creepy crawly method of lockdown. Dr. Letlape, I came in there because I wanted to ask you about the vaccine rollout. Many South Africans who are critics of the way government has handled this are saying that if government got their act together, it wouldn't have been so bad as far as numbers are concerned. If we'd gotten vaccines earlier, were we ever realistically going to get herd immunity within a year and a half? Last question to you.
Well, I think we've been incredibly unfortunate in that the plans that have been put out by government have not worked out. I think if we really rolled up our sleeves, the government engaged with the corporate sector and the private sector for outside money to come in so that we have enough resources, we can mobilize. There are many, many nations in the OECD countries that are sitting on spare vaccines. And I think if we had the resources, we could go out and negotiate to have those vaccines transferred to us. We have a lot of capability. What we should stay away from is trying to get a first world situation. We should be unlocking all the possible places so that we could vaccinate. We should be getting are private practitioners that have their independent settings that give injections to patients on a daily basis coming onto the system, so that we have various sites. We should be, doing registration on site. We should be allowing all the people that we want to vaccinate now, the above 60s, to walk into the many places near to them to get vaccinated.
Doctor, do you think we should have gone for more vaccines?
Getting down to the 50-year-olds if you want the numbers to come up.
Doctor, do you think we should have used more vaccines? I don't mean the numbers of them. So right now we have Pfizer, we have Johnson & Johnson, but I think the last I heard there's about 17 different vaccines. And I know all of these things have to be regulated and checked and managed, but there are calls for government having not used the AstraZeneca vaccine because there was a small concern health-wise. Were we really in the position, and are we really in the position right now, Doctor, this really is my final question to you, to be as fussy as it seems we are being?
It's not a question of being fussy. We should always never forget that this is emergency use authorization. And it is important that those that hold the vaccine make an application. We can't, SAPRA can't go out and register things that people have not supported safety information and dossiers for us to consider. But if you just look at the vaccines that have been registered, the 2 or 3 that have been registered, we could go out and get a lot of those. And I think we should not undermine the fact that this is emergency use authorization. There's still some issues that have not been sorted out in terms of vaccines. We need to be able to collect the data and be able to see how people react. What is the positivity rate amongst those vaccinated? How many of them end up in hospital? Are the vaccines as better as they have promised from the studies that have come out from the companies with the information that they provided to the regulator for registration? So we must not be naive and think that vaccines can just be dished out without going through the proper measures. Can you imagine? We have a vaccine that we vaccinate 1 million people, 10 million people, and we discover that, oops, there's something that we overlooked.
Yeah,
there's a contaminant in the virus. The standard of producing it was not good. The positivity breakthrough infections are quite high. This is still an experimental situation. This is emergency use authorization.
Doctor, I'm going to say thank you so much, and I think you've made so much sense to viewers this morning, understanding how the vaccination process works, and also your thoughts on tougher lockdown restrictions in Gauteng, considering the numbers. My thanks to you for speaking to us this morning. Dr. Kgosi Letlape, health expert, joining us here on eNCA.